Hello and welcome to the Ending Body Burnout Show. We are your hosts, Chris and Philly, co-founders of a multi-award-winning functional medicine practice, serving busy people with energy, mood and gut issues.
While busyness, addictive doing, people-pleasing and perfectionism might be the norm, it's not normal, and it's a major contributor to health issues.
Our goal with this show is to give you a holistic root cause approach to healing your body so that you don't have to continue doctor or diet hopping or popping a gazillion supplements hoping something might stick.
So get ready to heal your body, get your spark back, deeply connect with yourself and step into the life of your dreams.
Let's dive in.
Hello, podcast people. How are you? I'm very excited to bring another guest onto our podcast this week. We get quite a few pitches through email from strangers who want to come on our podcast, which is lovely. It's lovely that people find our podcast of value and want to share their message on our podcast. A lot of the times we reject them kindly. But sometimes we'll say yes to a stranger that I've never heard about, but when I look into them, I'm like, oh, really great fit, or like, oh my gosh, this person's incredible. And this was the case with Dr. Terri Fox. She's a USA integrative doctor, and she specializes in mold illness and Lyme disease. And this conversation was really practical. So she gives so much practical advice and tips around how to treat mold so it doesn't make you sicker. And I really love Dr. Terri's words of hope at the end. She said, getting a mold toxicity diagnosis is a great diagnosis because it's actually easy to treat and you get better fast. So I love that because a lot of the narrative that I hear in the functional medicine industry is, oh, you got mold, or, you know, even something like candida, it's so hard to get rid of. And I love that Dr. Terri is changing that narrative that actually, you know what, we can actually heal and detox from mold fast when you know how. I also wanted her to come on the show because last week, if you heard the conversation last week, I interviewed one of my business friends, Marie, and she shared quite generously her mold illness journey. So I thought it would be nice to back that one up with talking to an expert who also experienced her own mold illness, but to give you some really tangible tips in terms of like, how do you actually treat mold? And it is something that we do in our practice as well. So officially, Dr. Terri Fox is a holistic, integrative, functional medicine doctor in Boulder, Colorado. She has been practicing functional medicine for 22 years. She works on her patients' behalf as a medical detective, searching for underlying dysfunction instead of treating the symptoms. She is an expertise in chronic inflammatory response syndrome with mold toxicity and Lyme disease. Dr. Fox is a founding member of the International Society of Environmentally Acquired Illness. She is a founding physician for RAVEL, an organisation committed to bringing affordable care to Lyme patients. She is on the medical advisory panel for Change the Air Foundation. You can kind of see why I said yes to this woman because she's pretty phenomenal. Dr. Fox has launched a mold treatment masterclass, an online treatment course for patients with mold toxicity. She is committed to bringing safe and effective mold treatment to people all over the world. She is the founder of Boulder Holistic Functional Medicine in Boulder, Colorado. Let's dive into today's convo. It's a great one. Welcome to the podcast, everybody. I'm super excited to have an amazing guest here I am so excited to learn from her, Dr. Terri Fox, who is a specialist in mold illness and Lyme disease. And we're going to dive right in. Thank you so much for coming onto our podcast today.
Thank you so much for having me. I'm a fan.
Yay, I'm excited. Okay, so I find that in this holistic, integrative wellness space, a lot of practitioners who end up doing what they do often have their own story, health journey. Are you happy to dive into that. Did you get into mold illness and mold toxicity because of your own story? What did that look like for you?
Yeah. So, it was a long time ago now, it feels like, but when my son was 8 years old, he started he started limping and he started getting anxious. He started getting stiff. He was one of these like really like thrill seeking, active, crazy, fearless young boys that was always running at full speed and climbing up things and jumping off. And then suddenly he was limping. And, I'm a functional medicine doctor. I was doing some Lyme at that time. I really didn't want it to be Lyme. So I like tested him for everything. And, yeah, he got sick a lot and he had anxiety and stuff that he just never had before. And oddly, he was really like an underweight, kind of scrappy little kid, born a little early. And then he started putting on all this weight out of nowhere. And so yeah, I eventually figured out it was Lyme and tried to start treating him myself. And that's never a good idea as a doctor to treat your kid with something complicated like that.
Mm.
So I took him to a bunch of several Lyme docs that were really, really great in Colorado. And then I ended up flying him out to see Dr. Stephen Harris, who's a wonderful Lyme doc in California. And he started him on some antibiotics, and then he gave us a urinary mycotoxin test. And this was over 10 years ago. I mean, I didn't know anything about mold. And so we did the test on my son, and it was really, really high.
Mm.
And so at that stage, we knew, oh, there's something else going on. And so I was able to get a good indoor environmental professional out to the house who, did a full evaluation of the house and the attics and crawl spaces and, the vents and everything. And they found 3 feet of water under our entire house.
Whoa.
So it was the year of the Boulder flood. Boulder had like 100-year flood, and our whole block got destroyed. Like everybody's house got destroyed.
Mm.
And we had one of those blocks where there was tons of kids the same age, and they'd all go out and play together all the time, and it was super great. And we thought we had somehow come out of the flood okay, but it was under the vapor barrier in our crawl space.
Mm.
So the guy actually cut the vapor barrier and there was 3 feet of water under the whole house.
Wow.
And the airborne spore traps were in the red, which I mean, I don't think I've ever seen airborne spore traps in the red since then. It
Mm.
was pretty awful. And yeah, so he progressed and he got worse. And so I had done like a partial water damage fix because I knew nothing at that time about mold remediation and how to do it right and how to, not just spread it and make it worse. And so initially I had like a family run construction company out, and there was a leak in the attic above his room. And so they came in and fixed the water leak, but I didn't know about negative air or containment or anything. So they pulled out like wet, moldy drywall and then carried it through his room and the rest of the house. And that just sort of spreads it everywhere. It just goes, poof. As soon as you disturb it, it gets angry and lets off a bunch of mycotoxins. And from that moment, he didn't get out of bed for 6 months. He was in like 9 out of 10 pain in his head.
Oh,
Yeah, it was awful.
wow.
And then it was after that that I got the good indoor environmental professional out.
Mm.
And so, it was took a while to get the house properly remediated. It was a absolute mess. And I really didn't believe that my son was going to get better in that house because it was so bad. And so after about 6 months and lots of doctor visits and ER visits and inpatient hospital stays and countless, endless nights up researching and trying to figure out things for him. we ended up, getting the house remediated, selling it, and my marriage didn't make it out. But
Wow.
once we moved out, my son got better, and
Mm,
yeah, we put him on phase 2 of mold detox, which is antifungals and
mm,
biofilm, and he got better pretty quickly. I think as kids do, they a bit more resilient.
mm,
Um, and yeah, and so that opened me up to the world of mold illness. I was sick at the time as well. But you said you have kids, right?
yeah.
Yeah. So you think of most moms think of their kids
Yeah.
first. And so, I was having crazy anxiety. I'd never really had much anxiety and migraines and insomnia. And, I just kind of ignored myself until my kid was okay.
Mm,
Uh, and then, kind of later went back to treating myself and getting well.
mm,
There was a lot of fight or flight with, having two little kids, one really sick, getting divorced, moving. I felt like I was sort of, left the whole thing with nothing and starting over in my 40s with two kids. And,
yeah.
you know, yeah, and you talk about burnout. It was pretty intense for a while.
Yeah. Well, around burnout as well. So, do you see a link there? So, people who have experienced or are experiencing a lot of chronic stresses, they're doing a lot of things, juggling a lot of things. Do you see a link with more susceptibility to developing mold related symptoms when someone is in that chronic stress burnout phase?
Yeah, I mean, I think stress and all the things that stress does to your physiology and different parts of your physiology can contribute to your being more susceptible. And then there's a thing with mold exposure and trauma. So if it happens in a moment of time in your life where you're experiencing something traumatic,
Mm,
it tends to get deeper into the system and into the nervous system, and it's a bit harder to treat until somebody actually starts to handle their trauma.
yeah, right. Yeah. Do you like,
Yeah.
was that part of your healing as well? Not just getting rid of the mold, but all the stuff you were going through with worrying about your
Oh,
child and like the
oh
divorce
yeah.
and all that sort of stuff. Yeah.
Yeah, lots of therapy and I
Mm,
don't know if you're familiar with EMDR.
yeah.
That's a type of, I love that. So I did lots of that. I did shamanic journeys. I, did as much, tons of work on myself over the years after that. It was sort of, off and on and a little bit slower than ideal because, I was a single mom with two kids and working as a
Mm,
physician. So I didn't have all the time in the world to do my own healing, but I did it little by little over time.
yeah. Yeah, which I think is a good piece of lesson as well for people who are often parents and they're working and their health isn't very good. You don't actually have to go away to Fiji for 6 months to heal. But that, like, what is, I mean, it would be really nice. What did that
That'd
look
be
like?
awesome.
When you say little by little, like, what did that actually look like for you? And what do you feel, why do you feel like that was successful? Like, was it the little by little consistency or? Because this is, I feel like, is where people get stuck with the healing is that they're like, oh, it's just
Yeah,
too hard. Now I'm getting burnt out from trying to heal from mold or whatever it is.
right, right. So there were two parts. One, I didn't actually treat myself for mold at the time.
Mm.
And so I didn't really do that until he was well and I came up for air maybe two years later.
Yeah, okay.
And I started phase 2 mold detox antifungals, and the migraines I was having like constantly just went away immediately. And then I wanted to shoot myself for not treating myself
Yeah.
sooner. I was like, what were you thinking?
Mm,
Um, and then it was kind of like, fits and bursts of, like, okay, I'm gonna do therapy. I'm not okay. I've just been through so much trauma. And so I would, dive in and do it once a week or once every 2 weeks with EMDR is a particular kind of therapy that helps retrain your nervous system that works just really nicely for me.
mm,
And so, I would do maybe 6 months of it and I would do some, when I maybe didn't have the kids for a moment, I would do some healing, like shamanic journeys and different stuff. Was I have a lot of my friends are all kind of healers
Mm.
from, when I lived in San Francisco for a long time. So I, worked with a lot of them, and I did a few things the whole time. So, like I always exercised through it in order to relieve some stress
Mm.
and get some inspiration. So there were some threads of things that I was able to keep during the whole thing. And then, I would kind of dive in for periods with therapy or, other healing modalities. And then I would get super busy. And then, I would dive back in a few months later.
Yeah.
Yeah.
Yeah. Yeah. That's cool. Okay. So since then you've worked with lots and lots of people with mold issues. What are the common signs and symptoms that you see
Yeah,
with mold
sure.
toxicity?
Yeah. So there's a lot, but fatigue and brain fog, cognitive dysfunction of all kinds, word recall, memory loss, all that kind of stuff. And then headaches and migraines, very common. And then anxiety and insomnia, very common. And then sometimes depression, other. And kids, it presents with more neuropsych things like OCD and tics and things like that, sensory integration. Um, and then there's a lot more commonly in adults and kids is that there's unusual neurological presentations that don't fit into any neurological diagnosis. So, asymmetrical weakness, numbness, tingling, burning sensations, ice pick sensations, crawling sensations, muscle fasciculations where all your, muscles are twitching,
Mm.
balance issues, there's a lot of visual changes.
Mm.
So those are all kind of the neuro things that don't really fit into a neurological diagnosis.
Mm.
And then one of the other really common things that's always a tip off for me is rapid weight gain or loss. That's
Mm.
like unexplainable. Like I dropped 15 pounds that I didn't need to lose and looked emaciated. And
Wow.
my tiny little son put on 30 pounds. His
Wow.
tiny little frame.
Yeah.
Yeah, it was like a completely different kid, and he was so uncomfortable.
Mm.
That's a common and weight gain, weight loss.
Mm.
Sometimes that she stuff, anything fungal will give increased rashes.
Mm. Yeah. Something that I've seen, which I'm not sure if you mentioned it, like allergies is quite a common one as well.
Allergies,
Yeah.
yeah, they get a lot worse.
Yeah.
Congestion and wheezing and coughing.
Yeah.
Yeah.
Yeah. The weight's interesting in the way that it showed up completely different between you and your son. What's the actual physiology of what's happening there for someone who either like has the rapid weight loss or the rapid weight gain? I'm curious.
I could talk about the physiology for all the rest of it.
Yeah.
I think it affects leptin in some way,
Mm.
but I think many of us in the field checked leptin levels and it didn't exactly correlate the way you would think, with the weight changes. I'm honestly not sure
Mm.
about the pathophysiology of the weight gain and loss.
Mm.
It doesn't have anything to do with like what you're eating.
Yeah. It's so, yeah, I
Yeah.
find mold, maybe histamine stuff as well, which mold then can trigger a histamine intolerance or sensitivity or an overload. But it's like
And,
the weird stuff. It's the weird stuff that like a doctor or maybe just a standard naturopath would just be like, I don't really know what's going on there. That's weird.
right,
Yeah.
right. So now there's all this information around MCAS and,
Mm.
all that people that get huge full body histamine dumps and,
Mm.
get hives and throat swelling anaphylaxis. We actually treated him for that, but I don't think he had that at the time.
Yeah, okay. Yeah. So it's not always linked. There might just be like a solo mold issue, or it could be, oh, he had Lyme as well, though. Yeah.
He did. He
Yeah.
did.
Yeah.
And mold's a common trigger for MCAS, but not every mold patient has MCAS.
Yeah. Yeah. Which is also why people show up with different symptoms as well, because it's not just one thing. It's often like a complex of different things, and a body will respond to mold in different ways depending on what else is going on in their system. Okay, so
Yeah.
in functional medicine, I mean, we have a motto, and I'm pretty sure you do too: test, not guess. It's like, let's actually figure out what's going on and run some tests. So, what are your go-to tests to one, pinpoint if there's a mold toxicity issue, and do you do any other testing on other body systems to help in terms of treatment and clearing the mold spores from the body?
I do tons of testing.
Mm-hmm.
I'm a scientist and a doctor, and I love data. And so, but for mold specifically, I really just do a urinary mycotoxin test.
Mm-hmm.
So here in the US, we have real-time labs. I really like theirs. They've been around a long time. And Vibrant is another company that does a good urinary mycotoxin test.
Mm-hmm.
And so the real-time labs one is very specific, meaning you don't get false positives with food and things like that, but it's not as sensitive, so you can miss a decent amount of it. And so I do a pretty serious provocation here with for the real-time labs. I do an IV of phosphatidylcholine and glutathione, and then I collect their urine after.
Mm-hmm.
And so the people that get sick from mold are the ones that can't detox it. They can't metabolize it and get it out in the stool and the sweat. And so it just builds up in the system until it, overflows the system and the system crashes.
Mm-hmm.
So if you just do a spot urine, you might not catch it because, I mean, really, if they were metabolizing it and detoxing it in the urine, they probably wouldn't end up in my office.
Mm-hmm.
And so yeah, I provoke that one. The Vibrant one, I do a little provocation. It doesn't have to be provoked. You can do some liposomal glutathione and an infrared sauna or a hot bath or, something like that as a provocation.
Mm. So
Yeah.
that's an important step, because if you weren't doing the provocation, then it might be inconclusive, the results. Yeah.
False negative. Yeah, especially for the real-time labs. That one really has to be provoked.
Yeah. Okay.
But
So
do you guys have that one?
do we have the real time?
Yeah. Get it there, do you know?
We use RN Labs. I think it might be. I can't remember what brand it is, but there's
Yeah,
a
no.
mold toxin
Okay.
one that we get from America.
Okay.
Yeah.
I wonder, it might be Vibrant.
Yeah.
Yeah.
Okay.
And then I do a really big blood draw, comprehensive blood draw on everybody with mold because, a lot of times it's an endocrine disruptor, it's a nerve toxin, affects the central nervous system. And a lot of times by the time I get a patient in clinic, the whole system is crashed. So, they've got no thyroid, they've got no androgens, no testosterone or DHEA. Their, nutrients are really low. And so I sort of feed the system to try to strengthen it enough to
Mm,
undergo mold detox and treatment. Um, and so like I usually do it that way. I kind of feed it with all the things that it's low in and get
mm,
it as strong. And then I do, a 2-phase mold detox protocol.
mm. Yeah. Okay. Cool. So testing for mold, but then also looking at other key body systems that are often depleted to then increase the body's capacity to be able to clear the mold. Yeah.
Exactly.
Yeah.
Exactly. Yeah.
Cool. So can we dig into the detox, or sorry, the phases? So your protocol for clearing mold. You've got two main phases. Yeah.
Yeah. So it's 2 phases. It's a mold eradication protocol. In phase one, what we're doing is basically teaching the body how to begin pulling out and detoxifying and metabolizing these mycotoxins. So you can like begin to take that total body burden load down a bit. But the body has to sort of learn how to pull them out before you can, throw in an antifungal that would kill colonized mold in the system, in the body. But if when you kill colonized or living mold in the body, it releases its contents, which are those mycotoxins that make you sick.
Mm-hmm.
So mycotoxins are the toxins that mold release, and when you kill them, it releases more. And so the body has to sort of be practiced at catching those and pulling them out. And so the order is really important, and the pace at which you do it. So one of this, some of the things that people, do frequently that they're unsuccessful or they make themselves more sick is, they go too fast. They up all their binders too quickly and they start antifungals way too quickly in the process. And so there's it's a pretty easy to follow order of things that you
Mm,
can do to keep yourself from making yourself more sick
mm, yeah.
by releasing more mold toxins and your body can get out.
Yeah. Do you like, is that always just like cut and dry when it comes to mold, the detox, binding, and then the killing? Or does sometimes you have to flip that? Like, I'm thinking about if someone has a lot of gut issues and there's leaky gut and there's, I don't know, candida and parasites and overgrowth, that one of the ways we detox is back through the gut, out through the bowels. So sometimes you have to change that order a little bit, or like kind of like back and forth between gut detox
Oh,
before clearing it out?
100%.
Mm.
So there's nothing black and white about what I do.
Yeah.
Um, but yeah, so I mean, if somebody's not eliminating, you have to get them eliminating before you can start phase one, because phase
Mm.
one is binders and glutathione and nasal sprays and organ detox that helps you open up all your own detoxification pathways to begin draining these things that have
Mm.
built up in your bucket and your total body burden. And so, you do that for a while until your body's sort of practiced at it. But you have to be eliminating first because they're going to make you more constipated. And if you get completely constipated, then the protocol won't work. And so
Mm.
a big part of it is figuring out how to get your bowels regular and moving.
Mm.
And one of the really interesting and weird things is people that have more IBS like symptoms that alternate from diarrhea to constipation, they get really nervous about going on binders,
Mm.
but I can't tell you how often it seems to just regulate it. Like there's something
Mm.
about the binders are constipating, and then you take your magnesium, which is stool softening, and then before you know it, they're having like regular movements every day.
Yeah. Yeah.
Um, yeah. And so, and, I do stool studies all the time and do, gut healing as well. But
Mm.
so mold can colonize in the upper respiratory tract or the GI tract.
Mm.
And so a lot of times the gut dysfunction is actually mold living in your gastrointestinal tract.
Mm.
And so, it's the protocol is actually what gets at that underlying dysfunction.
Mm.
But if somebody's with some of their primary symptoms are GI, I'm probably going to make them do a stool study and food panel at the
Mm.
beginning as well.
Yeah, so kind of like getting that system working better before you then go and do the pulling out the mold. I've seen a link with SIBO, so reoccurring small intestinal bacterial overgrowth, when it's just like, why are you back again? Why are you back again? What's going on? Have you seen a link with that and an underlying hidden mold issue?
Yeah, so where there's mold, there's yeast. So they're both fungal, and mold creates all the right environment for yeast to flourish and go crazy. And so what I found after doing this for 12 or 15 years is that yeast is a part of every mold case. Sometimes it's a huge part of the case, and sometimes it's a little part, and you don't really know until you start getting in there and treating it. But the water damaged buildings have yeast in them as well. Like they have candida and other
Mm,
different forms of yeast. And so clearing yeast is a big part of the mold protocol for me.
mm,
Did I
yeah.
answer your question? What was your question?
Yeah, it was also about SIBO as well, so the bacterial
That's
overgrowth.
sorry. I knew I didn't get to it. So I think a lot of SIBO is SIFO, small
Mm,
intestinal fungal overgrowth. And so the way that I treat yeast, usually we'll get rid of the SIBO or the SIFO. And then sometimes it'll go away with mold treatment. But yeah, I don't even do those SIBO protocols anymore with the 20 different herbs and the,
elemental
biofilm and
diet.
the Faximin, yeah, and the FODMAPs, because I just find it just comes back. Like it just sort of
Yeah.
it doesn't clear it, with rifaximin and
Yeah.
people do have D3 anyways. So yeah,
Is
are you familiar with low dose immunotherapy?
hmm, No.
LDL.
Mm-mm.
So I use that for yeast. I find
Mm.
it's really effective and
Yeah, right.
pretty dramatic in the results. Yeah.
Yeah.
And a lot of times that's what gets rid of the SIBO or SIFO.
Yeah, cool. Great. Um, I know people always like to know the specifics. So, are you happy to share some supplements or nutrients,
Oh, yeah.
herbs that you would use in phase one of the wine? What is it? The binding of the
Bind
toxins,
and
and then the
unwind.
killing. Yeah.
Yeah. So phase one is bind and unwind.
Mm.
And so that is some liposomal glutathione oral. I have several brands that I like. I'm not sure do you have brands you like that you guys can get out there?
Designs for health, bioceuticals, metagenics.
Yeah, yeah. So I like Body Bios. I like Research Nutritionals, Try Fortify. I like Essential Pro. I like Quicksilver Scientifics, they're liposomal. Um, yeah, there's a lot. You just want it to be liposomal or
Yeah.
else it won't really work because you'll digest it. And
Mm.
then you pick the binders based on your urinary mycotoxin results. So there's different binders for different strains of mold. So for example, if you have trichothecenes show up on your urinary mycotoxin test, trichothecenes come from black mold or Stachybotrys.
Mm.
They're very strong, intense nerve toxins that attack your nervous system. They have been used as chemical warfare agents.
Mm.
They're pretty nasty, but like if you use cholestyramine, it won't touch trichothecenes. So the best binder for trichothecenes is activated charcoal.
Mm.
And then there's another mycotoxin called gliotoxin that comes from Aspergillus, several different forms. And that best binder, the binder that has the best affinity for it, is bentonite clay. So you pick your binders based on your results,
Mm.
and you layer them in one by one to make sure that you don't try to pull out more than the body can actually detox in the urine, the stool, and the sweat, and you don't make yourself more sick. So you kind of start with one and you work your way up, you layer in the next one, you work your way up. If you ever feel systemically worse,
Mm.
you decrease your dose, try it again the next week to see if it was coincidence or not. And if it wasn't, you stay there for a while.
Yeah.
Um, so yeah, so there's binders, there's glutathione, there's nasal sprays. Nasal sprays are kind of trying to kill any colonized mold in the system because this is the most common place. So
Mm.
the sinuses it's just the most common place where it will live in you after a
Mm.
mold exposure.
Can I
And
just
so
ask?
they're trying,
Can I ask a question about that?
absolutely,
Is the nasal spray part of phase two when it's time to kill off, or is that still the binding phase?
that's phase one. Yeah.
Yeah. Okay.
Yeah, so the phase one is glutathione to help you. So glutathione is needed for phase two detox to metabolize mycotoxins. And when you've had a big mold exposure, your body uses up all your glutathione to try to get it out on its own.
Mm.
And so it tends to be depleted. And when your glutathione is depleted, you can't detox mold, but also you have a lot of cognitive dysfunction because it's really needed for brain health.
Mm.
And low glutathione levels are associated with higher risk of all forms of dementia. And so there's glutathione, there's the binders for your specific mycotoxin load. And then there's the nasal sprays to try to get a little agent in here.
Mhm.
And then there's organ detox support, which we call drainage also. And it's really just trying to open up your own kidney, liver, lymphatic, extracellular matrix drainage that you can begin draining these things that are sort of filling up your bucket, and mycotoxins and other toxins as well.
Yeah. So cool. And
Yeah,
then for phase two, when it's all about killing off, pulling it out,
kill or be killed.
kill or be killed. Intense.
So
It's
that
like,
is like
I'll
the
do that. I will
I
kill. I
know,
don't want to be
right?
killed.
Bind and unwind or kill or be killed. So the way I think of it is mold is on the planet to decompose and turn over organic
Mm,
matter
true.
and turn it into new rich soil. But if you've got
Mm,
mold living in your system, you don't want it to decompose your, living organism from the inside out.
mm,
And the truth is if it's a previous exposure and it's living in you, the binders are never gonna, they'll bind the mycotoxins that are releasing and you might feel better, but they're gonna keep releasing mycotoxins and increasing your load until you kill whatever's in the system. And so phase 2 is antifungals and biofilm. You want me to just describe what
Yeah,
biofilm
that'd be
is?
great. Yeah. Yep.
Yeah. So here, I'll do the whole so colonization means that you've sort of picked it up and it's made a home in you. So maybe you had a mold exposure when you got sick, or you don't even live there anymore, but you've sort of brought it with you. And so imagine you're sleeping in a house that has, water damage and a lot of mold. And, eventually one night while you're sleeping and it's humid and the mold is sporulating, you're going to breathe one into your sinuses and it can stick, replicate, have babies, and create communities and families, and they aggregate together to form a
Yum.
colony. And I know, right? So nice. And then they secrete this glycoprotein matrix around the colony that protects them from your immune system. Then your immune system can't get at them, and your
Yeah.
antifungal agents can't get at them. They
It's
can't
like
even
their
really see it.
house.
Their house that
Yeah.
protects them. And so eventually you've got to get through the biofilm in order to get rid of it entirely. But again, it's really critical that it's all done in the right order. So some people will find out they have mold and then they'll start with a biofilm agent, and then they're opening up this whole colony of mold and mycotoxins and releasing it into the body. So you're just flooding the body with more of the very same thing that made you sick in the first place. And then they go, I can't do this. I can't do this mold detox. But, if you do it in the right order, it's really very painless.
Yeah.
It's a bit of a pain in the butt. It's complicated, but you should always feel better or nothing. You shouldn't feel significantly worse in a good
Yeah.
mold protocol.
Yeah. Yeah. So you get the binders. With the biofilms, are you doing them like prior to then taking the
Antifungals
mold?
first.
Yeah. Okay. Yeah.
Yeah. So you want to take down the load, kill what you can, and then you layer in the biofilm and start
To
opening
then
things
open up
up.
the house. Yeah.
Right. But by then, your body is like catching the mold that's released with the binders and metabolizing it with the glutathione. And truly, clinically, and I think most of my colleagues feel the same way, is the needle changes, moves the most when you start the antifungals. That's when people go, oh my gosh, I feel okay again. Like I
Yeah.
feel so much better. But
Yeah.
if you do them right in the very beginning, you're not going to feel better.
Yeah. Yeah. The antifungals in phase 2, are you basing those off the mold test as well? Like the different types of mold, and then there's specific antifungals, or it's kind of just broad spectrum, it kills everything?
Yeah. So I start with the broad spectrum one,
Yeah.
and itraconazole, and I do it with nystatin. And then, if we don't get all the way there or we're not getting much of a response, then I'll switch to voriconazole, which gets some different strains, but isn't as broad spectrum. And then if for some reason somebody can't tolerate itra or voriconazole, I would do like an amphotericin B, compounded liposomal.
Yeah.
And there are some herbal antifungals that I've had some luck with, but not quite as much, unfortunately, because mostly I like to try to tackle things organically or naturally, and uh, yeah.
Yeah. Sometimes you need something a bit heavier. Okay, so I have a question around, because in our practice we do a lot of like deeper what we call metaphysical work. So we tend to get a lot of people who have done so many protocols, so many physical protocols, and and it even like if I review their labs and I review what they've done, it's kind of like, yeah, that kind of, yeah, you like, it looks good, you've been doing the right things. But then their response is, but I still feel crappy, or even worse. So just circling right back to what you were chatting about with your own journey as well, and you realize that there's like, okay, there's a trauma and a nervous system component to it. Are you happy to chat about the connection between the nervous system and the importance of supporting that part of you as well when it comes to fully being able to recover from mold toxicity.
Yeah, absolutely. So, some kind of nervous system resetting is necessary for most of my mold patients, at least. So, the patients I tend to see have been, have had chronic complex illness for years, and they can't work and they can't do very much, and it's traumatic unto itself,
Mm,
the actual getting sick and the disease, and then you go see 20 specialists and doctors, and they all say there's nothing wrong with you, and they start feeling like they're crazy,
mm,
and there's trauma from the medical system saying there's nothing wrong with you. Like, take an antidepressant, just get up. Or, there's trauma from that. And then there's trauma from being sick and not being able to, do the things that you love that bring you balance and joy and take care of your kids and go to work and, all of that. And then, a lot of people have trauma as well. And if it happened at, around the same time, that absolutely needs to get worked on. And so I sort of divide it into two different categories. So limbic retraining and then vagal retraining or toning. And, ideally, if somebody's really sick and sensitive, they do both.
mm,
But sometimes we can sort of decide which one might be more appropriate based on their clinical picture and symptoms.
mm,
And then if patients are not progressing, or let's say they're in phase one and they can't get past 2 caps of activated charcoal,
mm,
then I have them go directly to the nervous system reset module and,
mm,
start there. Um, and then, so sometimes it has to come in the beginning in order for them to even do the
mm,
treatment successfully or a protocol. And then at the end, almost everybody has to do it because mold is everywhere, and
mm.
we live in these, buildings that are made of mold food with water pipes going through them. And, we sort of hope for the best, and water is going to happen.
Yeah.
Mold is going to happen. It's around. And if we panic every single time we walk into another building that is moldy, or we get a little water leak somewhere in our home, then basically, it's not that it's in your head,
Mm,
but your head is making it worse. So your fear and panic and anxiety and emotional response to the physical symptom of, or just even smelling it and the fear of the symptoms
mm,
coming back, they exacerbate the inflammatory pathway of mold itself.
mhm.
And so, like, if you can separate the physical sensation from the emotional response, that can help settle things a
Mm.
bit so that you're not quite as, at least emotionally, limbic, adrenally reactive
Yeah.
when you get an exposure, because they're going to happen. And so you got to kind of come to peace with,
Yeah.
it's okay. I'm going to be fine. And my body has learned how to do this. I know how to do this. I know
Mm,
what to do. I've gotten better before. I'm going to get better again. And it's going to
mm,
be quick this time.
mm.
Uh, yeah.
Yeah.
So do you guys also do a lot of limbic and vagal retraining? Yeah.
Yeah. And we probably go, I don't know if the word is deeper or higher, but also looking at like deep unconscious core beliefs that is the framework in which you're perceiving yourself and your environment and the world around you. So a lot of the times too, when there's been a chronic presentation, there's beliefs that have been created along the way that, like, either I'm the weird one, I'm broken, I'm sensitive, I'm weak, my body can't handle this.
Mhm.
And so, yeah, it's
Or
looking at the brain, the neural pathways, nervous system, but also deeper beliefs and past distressing events that can stay stuck in your system as well, that then feed that amygdala part of the brain, the fear part that freaks out when it's exposed to old triggers.
Exactly.
Mm,
Yeah. And even like patients identifying with being sick
mm,
or being patient, like I have to, there's some point in the that work that we're doing together that I have to tell them, you're healthy, and you got to believe you're healthy, and you got to start telling yourself you're
yeah,
healthy.
yeah,
Because you don't want to walk around saying I'm sick
yeah,
forever. You will be.
yeah. And often there's secondary gains around that too, that this is how I've unresourcefully found significance, or this is how I used to be the person that did everything for everyone else. And so then when I got sick, suddenly the tide turned, and actually it felt nice to be looked after for once in my life. So that, there's a lot of so many different intricacies that need to be exposed, unraveled, let go of. Something that you mentioned around, was it vagal tone and amygdala work? And you said sometimes you will send a patient to one or the other depending on what's happening for them.
Right.
Can you just explain that a little bit? Like, when would you, what are the
I
difference
will.
between the two, and when, and what presentation would you see as one or the other?
So usually what I do, I have handouts and stuff that have, a bunch of programs that help with limbic retraining and a bunch that help with vagal toning. And I often tell them, just check them all out online, see which one resonates with you, because, it's like seeing a therapist. You have to sort of, resonate with them and feel like you speak the same language. And then, so this is my personal clinical experience. I don't know that this has any real data behind it, but when somebody's presentation is a lot of, nausea, hiccups, reflux, or throat stuff, or palpitations, or, things that are obviously in line with the vagus nerve, I'll often have them start off with that. And there's one program that does both, which is really nice. So if the clinical symptoms sound, so the vagus nerve goes from your brainstem to your diaphragm, and if a lot of their presentation is things that are triggered in that area, then I'll often tell them to, start with some vagal retraining.
Yeah, that was definitely my old issues. Where I always used to say to myself, or like when I started working with practitioners before I became a practitioner myself, it's like, it's here. It's kind of like from the top of my throat right down to the bottom of my boobs. Like, everything happens here.
Exactly.
Vagus nerve. And what about the amygdala? So would that be more maybe like mental, emotional thought pattern presentation, or?
Right. I mean, I sort of put that into, both, honestly, but a little bit more, I think, of the limbic retraining. But I guess I would imagine that vagal retraining and having your system be able to go appropriately between parasympathetic and sympathetic is going to calm down the amygdala also. Do you know of anything that's directed directly at the amygdala?
Oh, I think it's probably more people respond to different, whether it's different practices, exercises. Like, if it's a real amygdala, the brain is freaking out. Oh my gosh, it's the trigger. I find both breaking the trigger. So identifying what is the trigger, if we're talking about mold, and noticing how your body responds to that, but then breaking the response. So then somatically bringing safety back to the body. And so it's like, okay, if we want a safe response now to mold, or, we work with a lot of people with food sensitivities, for example, then before you eat the dairy, start creating like a safety anchor in your body, and feel light and love, and bring a really safe and wonderful memory back, so that you can like viscerally feel that as you're consuming the dairy or sniffing the mold. I find that can be really helpful from the limbic point of view, but it's both top down, bottom up, because the body and mind are connected, so you need both approaches.
Yeah, I totally agree.
This has been awesome. So good. Thank you so much for generously sharing everything that you do, both your story, your son's story, but also giving some really tangible, practical steps in terms of how someone can effectively treat mold. Now, you have some awesome resources. Are you happy to share those to our audience? And we'll make sure that the links are in the show notes.
Yeah, of course. So I launched a live mold treatment class for patients last summer. I've felt, I can't, I'm an MD, so I can't treat people out of state because I'm not licensed in all the states. And, I get calls from people all over the world wanting to treat their mold. And I felt like I couldn't treat all of them. And, could I create something that was a little more do it yourself, but really kind of handheld and spoon fed and they're not going to make themselves more sick. And so I did a live course this summer with a live cohort. It went amazingly. I had some people in Australia in it.
Awesome.
Yeah. And so now I am sort of editing and repackaging and, getting it ready to just, sell it as a do-it-yourself class so that, because I really think a basic mold treatment protocol should be accessible to the world. And there's, the information's out there. And with all the natural disasters, I mean, our whole country has just flooded like 3 times in a row. Everybody's going to be mold sick in a year or so. That the information should be out there. And so I, created this course and now it's available now for, if anybody was interested in going through the course. And then we're going to do another launch at probably the end of November that'll have the course with live Q&As with me twice a month.
Awesome.
And so, so either is available, and that's drfoxmedicaldetective.com is the website. And then there's a webinar that I, did several times before I did the live course that's on there that talks a lot more about the class that you can watch. And you can also sign up for the newsletter and get a free mold prevention guide.
Yeah. So cool.
As soon as you get better from mold, you really just don't want it to happen again.
Yeah.
So the prevention is really, really nice.
Absolutely. Yeah.
Yeah. And then we also created a coupon code for all of your listeners.
Thank you.
That they can get $100 off of the course.
Awesome.
Yeah. And we'll put that in the show notes.
Awesome. Thank you so much. I will make sure they're all in the show notes. And any last words of wisdom if someone's struggling and they know they've got mold issues or maybe they've got all the weird health issues that we were just talking about, what would you say some like first step advice or words of wisdom or hope?
Yeah, I mean, the first thing that I want to say about mold is I find it really treatable. I find it to be a great diagnosis. People get better. They have wonderful clinical turnarounds. They get all the way better. It's not that long. It's not that painful. It's not one of those other diagnoses where you get worse before you get better. You should really feel better or neutral the whole way. And so, I just feel like absolutely have hope. It's really not that hard to get better from mold. The hardest part is to get yourself into a clean environment where you're no longer being exposed. And after that, to treat it and get rid of it and get your health back and your life back is totally possible. It's not a terrible diagnosis at all.
I love that. That's I love that because I feel like there's a big narrative that mold is really hard. It's going to be really hard to clear. You're going to have issues for a really long time. It makes you sick before you get better. So thank you for that. We're all about let's flip the narrative so that what if healing could be easy?
Yeah, exactly. I love that.
Awesome. All right. Well, thank you so much.
Well, thank you for having me. So nice to talk to you.
Awesome. And thanks everyone for listening today. Thank you so much for listening. We so appreciate you. If you'd like to give us extra smiles, drop us a review and spread the love by sharing this episode.
You can also rate your own state of burnout and the root cause contributors by taking our Ending Body Burnout Assessment on our website. And if you're interested in learning about our group or one-on-one Ending Body Burnout programs, shoot us a DM via Instagram or Facebook.
Have the best day ever.